Okay, we're going to talk about something where knowing the facts can literally save a life: rabies. And everything we're about to go through comes straight from India's official national guidelines. So you're getting the essential life-saving info you need if you ever have a close call with an animal.
Yeah, that's a pretty stark way to start, right? But it's there for a reason. This isn't about scaring you, it's about being brutally honest. A nearly 100% case fatality rate means that once the actual symptoms of rabies show up, it is almost always fatal. There's no coming back from it.
And that's exactly why this is so incredibly important. See, once symptoms start, there's no cure. It's an undefeated virus at that point. So every single thing we're about to talk about, it's all about what happens after a potential exposure. We're not trying to cure the disease, we're trying to stop it from ever getting a foothold in the first place. So how does this nasty virus actually get around? Well, it's all in the saliva of an infected animal. A bite is the most obvious way, of course, but a scratch that gets contaminated with saliva, just as dangerous. Even a simple lick on skin that's already broken or on your eyes or mouth can be enough. Now in India, dogs are the source for about 95% of human cases, but they're not the only ones. Cats, mongoose, jackals, they can carry it too. And the rule of thumb is simple: any bite from any wild animal is automatically considered a severe exposure, period.
Okay, but here's something you really need to get. Not all animal contact is the same. The medical response is totally dependent on the level of risk. So being able to accurately explain what happened to a doctor is absolutely crucial.
So how do you, or more importantly, how does a doctor figure out just how bad it is? Well, thankfully, the official guidelines have a really clear system to make sure everyone makes the right call. It's all broken down into three simple categories. Category 1 is the lowest risk. You touched or fed an animal, maybe it licked your hand, but your skin was totally intact. No problem, just wash it well. Category 2 is where it steps up, a nibble or a minor scratch, but, and this is key, without any bleeding. That needs proper wound care and the rabies vaccine. Then there's Category 3. This is the most serious. We're talking any bite or scratch that actually breaks the skin, or any lick on broken skin. This requires the full court press: wound care, the vaccine, and something called Rabies immunoglobulin to give your body an immediate defense. And you can see the difference right here, plain as day. On the left, that's a Category 2 scratch. See? No blood. On the right, that's a Category 3 bite. The skin is clearly broken. It seems like a small difference, but understanding this is everything, because jumping from Category 2 to 3 completely changes the medical game plan.
Okay, so let's say the worst happens. An animal bites you. What do you do in those first few absolutely critical minutes? These are the things you can and you must do before you even get to a doctor.
I want you to burn this number into your brain: 15. The guidelines are crystal clear. You need to flush and wash that wound with soap and running water for a full 15 minutes. This one simple action can physically remove and destroy the virus particles right there at the source, and it can massively reduce your risk. It's no joke. It's a simple 3-step drill. You gotta know this. Step 1, wash. For 15 solid minutes, set a timer if you have to. Step 2, after you're done washing, pat it dry and apply a real antiseptic like povidone iodine. Step 3, do not cover the wound. No bandages, no dressings. Leave it open to the air. That's your first aid mantra: wash, antiseptic, don't cover. Okay, just as important as what you should do is what you should never do. First, don't touch the wound with your bare hands if you can help it. Second, and this is critical, do not put things like soil, chili powder, oil, or any other folk remedies on it. They don't work and they can cause nasty infections. And finally, do not let anyone stitch the wound shut right away. It needs to be assessed by a doctor, and for Category 3 exposures, immunoglobulins have to be given before any stitches are even considered. All right, you've done your first aid. You've washed the wound. Now it's time for the medical pros. The treatment they're going to give you is called post-exposure prophylaxis. You'll hear it called PEP for short. This is the medical cavalry arriving to stop that virus dead in its tracks. So think of PEP as a 1-2 punch against the virus. The first punch for those really serious Category 3 exposures is rabies immunoglobulin, or RIG. This is like dropping a special forces team of pre-made antibodies right onto the wound to start fighting the virus immediately. It's instant temporary protection. The second punch for both Category 2 and 3 is the anti-rabies vaccine. This is the long-term strategy.
The vaccine is like a training manual for your own immune system, teaching it how to build its own army of antibodies for lasting protection.
And listen, this next part is maybe the most important of all. It's not a one-and-done deal. Getting that first shot is just the start of the battle. You have to finish the fight. You have to complete the entire vaccine schedule to be safe. So, your doctor might put you on one of two common schedules. The first one is called the intradermal or ID regimen. This means you'll have 4 visits to the clinic for small injections that go just into the top layer of your skin. You'll get them on day 0, that's your first visit, and then you have to come back on days 3, 7, and 28.
The other common one is the intramuscular or IM schedule. This shot goes a little deeper into your arm muscle, and this one requires 5 visits on days 0, 3, 7, 14, and 28. Now, a doctor will decide which one's right for you. Your job, your only job, is to show up for every single appointment. No excuses.
And let me be crystal clear about this because the guidelines are there is absolutely no reason to skip or delay this treatment. None. It's safe and it is essential for absolutely everyone, no matter how old or how young or what their health condition is. We're talking infants, pregnant women, the elderly. It doesn't matter. The risk from the rabies virus is always greater than any possible risk from the treatment.
All right, let's lock this in. What are the absolute must-know takeaways? Number 1, rabies is a killer once symptoms show up, so prevention is everything. 2, your first move always is to wash the wound with soap and water for 15 minutes. 3, get to a doctor immediately. 4, know the difference between category 1, 2, and 3 so you can tell them what happened. And 5, you absolutely positively must finish the entire vaccination schedule. No skipping.
So it all comes down to this strange paradox. A disease that's 100% fatal is also 100% preventable. The only thing that separates those two realities is knowledge and quick, decisive action. And now, you have that knowledge. The only question left is, will you be ready to use it?